Well, you'd think that the challenge would be having a good idea, but there are lots of smart people with good ideas. Finding financing to develop a good idea is even not that hard when you have as much access to capital as we have in a country like ours. It's a multi-stage process of not just getting through the FDA, who is generally fairly straightforward in their requirements and are easy to understand. The challenges are actually after the FDA. How do you get your device or your procedure paid for? So companies raise millions of dollars, people put in hours of sweat equity only to find that they can't market their device because nobody will pay for the procedure. And that's regardless of whether there's a CPT code or not. Just because there's a CPT code, which is another process unto itself, and in the world of innovation, time is money. Even if you get the code, there's no guarantee you'll be paid. When your new device is a new procedure, that's the greatest challenge. When your new device is a tool that you use in other procedures that's not linked to a specific CPT code, then it's a function of, is it the right price? Can you sell it to a hospital? But you're out of the problem of dealing with Medicare regulators, Blue Cross, the other major payers, and that's, comparatively, that's easy. Well, many physicians want to be able to provide cutting-edge tools to their patients. We're constantly striving to do things in a less invasive way, but at the end of the day, for a pure clinician in some town, in some state, in this country, to do procedures for which they can't get paid is not viable over the long haul. We need a method where these procedures that are sort of in between stages, where they're new and they're approved, maybe they have a code, the payers haven't fully decided what to do, we still have to have a way to make these accessible to our patients. That's the clinical trials process. We need data. And one of the great opportunities to do this are groups like the AGA CJIT that's doing registries, working with industry, collecting data. And I think that we need to work with the payers and say, we need you to pay, and in return, we're going to be part of the data collection process. We need to form new partnerships to be able to bring these procedures to our patients.